of a strong and responsive multilateral system. We want to see a WHO which is sustainably financed, accountable, and effective. For many years, the European Union and the WHO have been working closely together. The EU and its member states, as Team Europe, are amongst the most important donors to all key international global health institutions and initiatives, including the WHO. Since 2011, our cooperation with WHO has intensified under the Partnership on Health Systems Strengthening for Universal Health Coverage. This partnership provides flexible funding to the WHO, currently enabling support to 125 partner countries. But our cooperation goes much beyond this. I am proud today to announce, as part of the WHO investment round, that this represents a contribution of more than 250 million euros. Dear Dr. Tedros, I want to assure you that the EU will continue being WHO's strong and reliable partner, and I hope that other donors will join us in making this first investment round a success, so that no one is left behind.
So thank you very much on behalf of the Member States and the World Health Organization to the European Commission for that substantial pledge. A good start on this round, together with the other pledges we heard today and on Sunday. I then have the honor to invite the second panel. All of you can come up. We have Minister of Health and Aged Care in Australia, Mark Butler, Chris Elias, President for the Global Development at now the Gates Foundation. We have Lord Nick Markham, Minister for the Lords, UK, so Department of Health and Social Care. As you know, there's a general election starting soon in the UK, so we have the Lords. Yeah. And then Susanne Stensen, who is head of MOPAN, the Multilateral Organization for Performance Assessment Network, and the Secretariat. So I start with you, Minister Butler. We saw, and I experienced that in my previous role, Australia's great commitment to your region in the emergency, and how you're stepping up to be a leader, but working with WHO. So what's your perspectives on the role of WHO in the region, but also globally, on health emergencies?
Well, we are so lucky to live in this incredibly dynamic and diverse region, the Western Pacific. It's got a country of 1.4 billion people in it. It's also got countries that you measure in the hundreds in population. It's very diverse economically. It has some risks, for example, from climate change that are truly existential, not just the health impact risks that most of our countries deal with. So we're very focused on being a good partner in our region. We have a program amounting to around $620 million, our Healthy Partnerships program, particularly focused on Southeast Asia and the Pacific Islands. And we think that that's a really important way to build health security, to build highly capable health systems, to deal with some of those climate change impacts that range from very severe to genuinely existential. But we can't do that without a strong WHO. I mean, Australia, as a middle power, has always recognised the critical importance of a global rules-based order. That is one that ranges from security through health, through so many other elements of the 1948 global architecture, and we will continue to take that view. We have always, I think, been a strong funder of the work of the World Health Organization. We particularly place a premium on giving as much discretion to the organisation as we can with our flexible funds. I think we are the third or the fourth largest voluntary contributor in a flexible funding way. And when I look at the work program that's just been endorsed, We want to give the organisation as much flexibility to fund the implementation of that program. So we intend to continue to fund as much as we possibly can through our voluntary contributions in a flexible way and continue to be near the top of that table, and we encourage other nations to consider doing that as well. I also want to emphasise the importance of seeking to provide as much long-term security to the organisation as we can. We provide 4 or 5-year commitments through our voluntary funding program. All health ministers in the room will understand how hard that is to get from finance ministers and treasurers. I mean, I delivered a budget only in the last couple of weeks. There were very few domestic health organisations in my country that got more than 2-year commitments in our funding. So to be able to deliver a 4 or 5-year commitment through voluntary funding to the organisation is a big thing to be able to extract from our finance ministers and treasurers in the circumstances we all face with heavily constrained budgets. But we see it as an important demonstration of our commitment to the critical importance of the World Health Organization right across the globe, including in our incredibly dynamic region of the Western Pacific.
So, thank you, Minister Butler, both for your leadership in the region, the work with WIPRO, the WHO regional office, and also for leading the way in, as you said, providing sufficient flexibility for this organization so that it can be led and overseen by its board, but also the sustainability and the long-term funding so that it's predictable for the coming years. We then move to Chris Elias from the Gates Foundation. Gates Foundation is a really important contributor to the World Health Organization. I think we should all acknowledge that and thank you on behalf of all member states. What's your view on WHO's role now in achieving the top health priorities as we see in the 14th program of work? And given the quite a challenging fiscal and geopolitical environment, how can we best set up WHO for success now for the next 4 years?
Thank you, John Anna, and thank you, Dr. Tedros, and to all the WHO staff. First, let me commend your work on the investment case in great and diligent time as you were putting together in parallel the global program of work, and congratulations on that approval this morning, as well as the results framework. This important articulation of the opportunities in front of us in global health could not have come at a more important time. You know, during COVID-19, many things were set back. And one of the things that was set back was global solidarity. And I think one of our challenges, one of our ways to express the healing of global solidarity is coming together around this investment round and making it optimally successful. I think we're going to pull up for that. I think we face an unprecedented opportunity during the time of the Global Program of Work 14 to really not just get back on track after COVID-19, but to fast track our progress. And I think the WHO has a very, very important role to play in doing that. Especially, we don't want to miss the opportunity. The one thing that didn't slow down during COVID-19 was science. Science got accelerated by the challenge of the pandemic. We're facing one of the thickest pipelines of new innovations to improve lives and improve them faster than we have ever seen in the history of the world. You know, the Gates Foundation supports a lot of research and development, and we, through that, can see some of the opportunities coming through the revolution in digital health, through the appropriate application of artificial intelligence to empower frontline health workers, to get people referred to the right places at the right time. We don't want to miss that opportunity by having an underfunded World Health Organization. So I think this could not come at a better time, a more important time. And I want to applaud the member states for the important decision to increase the assessed contributions to the World Health Organization and to the GPW 14. That, again, could not have come at a more important time and is probably the single most important step forward in assuring that predictable and flexible financing for the World Health Organization. You know, in terms of our support, you'll notice in the appendix of the investment case that most of our support is earmarked. That has to do with how we align strategically around things like the investment case. But I looked at our grants. Generally, we make multi-year support. I think on average, our average grant to WHO is 3 to 5 years. And I had an important conversation starting last month and then yesterday with the ADGs to talk about how we can further align strategically and on leadership so that we can provide even more flexibility within those multi-year grants. So we'll continue to think about how best to bring our catalytic philanthropic resources to bear on this important body of work and to do it in partnership with all of you. So thank you again, and it's a pleasure to be here.
Thank you very much, Chris. Lord Markham, we just discussed with Australia as well the importance of flexible funding, and Australia is one of the leaders. UK is the biggest flexible funder of the World Health Organization. How would you want to inspire the rest of your fellow members here of the organization to do the same?
Well, thank you. I think the fact of the matter we all know is that we all face similar problems around the world. We all have aging populations. We've got global temperatures. We've set a series of vital health-related sustainable development goals. And there's only one body out there that can really fight them, and that's the WHO. And we need WHO to be in a position where it has those long-term resources. I mean, just 25 years ago, half of all its funding was provided in a flexible, predictable way. Today, it's less than 20%. And that gives a real problem. I mean, take the pandemic and what they had to suddenly do and respond to. That's very hard to do if you don't have the flexible resources to do that. So that's why, as you say, the UK is quite proud of taking that lead in terms of providing that flexibility. It's a matter of trust that it's in good, safe hands, and we've got the right people there to do it. So I think there's 3 good reasons to do it. Firstly, it allows the WHO to respond quickly and effectively to a health crisis. We saw that obviously in the pandemic. We see that all the time in humanitarian emergencies. And in the pandemic, if the WHO hadn't been there quickly to disseminate all the information around the pathogens, it would have been a lot harder battle. Secondly, again, if they've got the funding which is predictable, they can invest in the long-term priorities that is needed to support the most vulnerable, so that they can then really support countries to build the resilient healthcare systems and help countries move towards the universal health coverage. And then I think thirdly, and probably most importantly, we all know from our organisations the bedrock is the talent and being able to attract that talent. And it's only if you guys have got that long-term funding that you can feel confident to go out there and protect, and recruit and retain the world's best. And we need you to have the world's best in terms of doing that. That's why we're so happy this investment fund has been launched today. It's great to see the responses already from Singapore, Ireland, and the EU. It really is, as my colleague said, shows the global solidarity that we all have here. And so that's why we as the UK really want all the countries to get behind this flexible fund. Thank you.
Thank you, Lord Markham, and thank you for also reminding us that health is about people, yes, but WHO is also about people and the talent and the need for predictability to actually have a good talent base. So thanks to all staff at WHO for the work you do. We then move to Susanne Stensen from MOPAN, as I said. As you know, WHO is a member state organization. We have other member states sort of driven organizations in the multilateral system. And MOPAN, you are systematically keeping those organizations accountable to their members through regular reviews. Could you share reflections on the importance of flexible and sustainable financing for, in general, a multilateral organization.
Well, thank you very much, and a pleasure to be able to address this audience. Just a couple of words in terms of reflecting on MOPAN. So MOPAN is a network of 22 member states, and they together represent $100 billion of investment annually into the multilateral system. And they are very much part of this ecosystem and the conversation around this investment round. And it is obvious that what MOPAN is really trying to do through our assessments is to strengthen trust and knowledge about the institutions. You refer to the people, the organizations, and that's what MOPAN is about, trying to bring much more insights and understanding around the organizations. And so over the past year, we have worked with WHO to unpack WHO's performance, and I want to also thank WHO for having actually shown such openness to open their coffers so that we can better understand what WHO is about. This is the fourth assessment of MOPAN, and our understanding, the conclusions we are putting forth, which we will share much more, in much more detail on the 24th of June, is really about an organization that has been able to push through its reform journey since our previous assessment in 2018. And of course, this period has been, as you all know, really marked by COVID, and in spite of this extreme crisis, the organizations were really able to push through on the reform that it has launched, committed to, which is also quite a central pillar for this conversation on the investment round. Because investing in an organization is about also having trust, faith in the organization in terms of its ability to deliver results, but also to be accountable. So it's across our assessment today, MOPAN has been assessing more than, made more than 100 assessments, and it is obvious that the conversation about moving towards much more on-earmarked funding, higher quality funding, is quite a circular conversation across the multilateral system, but specifically here in WHO is quite unique, this advancement, but also it takes two to tango. It's a strong commitment by member states, but it's also a strong commitment by the organization. At the same time, if you, I hope on the 24th, you can dive a bit more deeper into our assessment. You'll see also as part of this contract is about how do we push through on organizational strengthening and improvement. And here it is about how do we strengthen actually WHO's contributions to results, because how can we account for WHO specific, actually, how is WHO contributing to moving the health outcomes that we are all seeking and talking about? So that's sort of elements, some of the highlights we have flagged in our assessments. And naturally, from our members' perspective, being able to have faith and reliability in those results, that's also where more predictable funding would flow through towards WHO. And naturally, I think it goes without saying that it's quite an undertaking by WHO, but also, again, by the member states for wanting to actually make this pledge collectively, but also work together in continuing the reform trajectory, which will be very, very important over the coming years. So.
Thank you, Susanne. You reminded us that indeed it takes two to tango. It's not only about plans and budgets, it's also about delivery. It's about effectiveness, efficiency, and delivery. And Lord Markham, you mentioned trust. So trust, accountability, and that's creating a positive spiral for improving the organization, and thereby also improving not the amount of funding necessarily, but the quality of funding, which really this investment round is about. Predictable, flexible, and sustainable financing. So please join me in giving also this panel a hand. So actually, I must say we have had two flexible, predictable and sustainable panels, because normally when we start 10 minutes late, we normally would be hard on time, but both panels have delivered content, quality, and predictability, sustainability, flexibility. So thank you. So this actually gives us the opportunity for a couple of comments, interventions from the floor. I believe Mauritania from the Ministry of Health has an intervention to make. As you know, Mauritania is the presidency of the African Union this year, so please, the floor is yours.
Merci, Monsieur le Modérateur.
Thank you, moderator. Director General of the World Health Organization, Regional Director of the WHO for Africa, Your Excellencies, distinguished guests, ladies and gentlemen. It is a considerable honor for my country to be the co-organizer of the investment cycle, and that here at the 77th World Health Assembly. We know that the slogan of this assembly is quite appropriately, all for health, health for all. All of us have to demonstrate solidarity to help countries better achieve universal health coverage at a moment when our countries are beginning to see finally the end to the COVID-19 crisis. We need to take advantage of the situation to further build and strengthen our health systems on the basis of universal health coverage. We would like to thank the World Health Organization for its effective management of the COVID crisis under the outstanding leadership of Dr. Tedros Ghebreyesus, and for the organization's help in providing vaccines to the countries of Africa. For our country and for our president, who is the acting president of the African Union, it is a great honor to express our total support to the WHO's investment cycle. We hope that it will help us to further develop and promote healthcare and coverage worldwide. While building on the progress we've already made, I would like to underscore the absolute critical importance of this investment cycle for the achieving of our goal of health for all for health. WHO needs to be able to fully play her role, and that means having stable, flexible, and predictable financing. The WHO investment cycle is, we think, a unique opportunity for us to build on political impetus for improving health, and we should focus, of course, on the 14th General Programme of Work. This, in its turn, focuses on achievable health and well-being for everyone. Africa, as we all know, is meeting and facing new challenges today related to climate change, which is, as we all know, also a threat to the environment and to the health of our populations, and it may contribute to the emergence of further health crises. WHO's investment cycle is a unique opportunity to build on what we've already done to further the development of health worldwide. In preparing for what we are going to do, we want at global level to see more dynamic action and the more active use of the opportunities we have, as well, of course, as significant contributions to the investment cycle. I urge countries to mobilize resources for this investment cycle so that we can strengthen our shared vision of global universal health coverage. We can achieve that and make good health a major component of our development and a right for everybody. But if we're to do that, we need to make a commitment now to put health at the heart of our policies and of our collective well-being. Thank you.
Thank you very much to Mauritania. As we heard earlier, Mauritania will be, on behalf of the African Union, one of the co-conveners on the investment round. We have time for one more from the floor. If you're ready, Jay Fumapi, who's co-chair of the Global Preparedness Monitoring Board, one of the partnership between the World Bank and WHO. Joey, please.
Thank you very much, Mr. Chair. On behalf of the Global Preparedness Monitoring Board, it gives me a great pleasure to underscore that WHO is the global coordinator for pandemic prevention, preparedness and response. Its role is to ensure equity in access to life-saving technologies, strengthening health systems, coordinating early warning systems, and detecting outbreaks. Systematic investments in both WHO and in countries through the Pandemic Fund for countries ensures equity and protects the global economy before the next pandemic. The GPMB has received feedback from countries that the Pandemic Fund should move away from being a proposal writing contest to providing adequate resources to bridge equity gaps in countries. Like this WHO investment case, the Pandemic Fund financing mechanism should be structured in closer collaboration with governments, communities, and the private sector. It costs tens of billions of US dollars to fully fund WHO and prepare countries equitably. It will cost the global community trillions when the next pandemic hits. It is therefore the position of the Global Preparedness Monitoring Board that if we don't invest in WHO now and in country preparedness now, we will pay a much heavier price in a few years. Thank you.
Thank you very much. Then, to close this, I will invite Dr. Jarbas Barbosa, the Regional Director of the Pan-American Health Organization, to close us. But before doing so, I would like to thank you all for being here, but actually thank those 15,000 who have been watching this online while we've been here. If those 15,000 contribute how much, then we get it? I'm not sure. As we heard, it's only 35 cents per person in the world. So less beer, less whatever, and it will be done. But Dr. Barbosa, please.
Thank you, John Arne. Your Excellency, honorable ministers, colleagues and friends, the friends that are here and the thousands of friends that are watching this very important session. Let me begin by thanking our speakers and panelists at this event today of All for Health, Health for All. We have learned a lot today about the investment case, and I would like to take a moment to pay tribute to the team who developed the document over the past 9 months, the staff from the Secretariat who authored the document, and also to the modeling consortia, institutions, and academic experts who committed their time, their knowledge, and energies to building such a strong case for investing in WHO. And of course, to the member states and other supporters who provided feedback on it. Since Sunday, when the investment round was launched, you have heard from many member states and donors that they are committed. Some of them have already announced their pledge. Others, they are announced that their commitment to provide more flexible, more predictable funds in order to support the very strong and necessary work that WHO and the coordination role that WHO has, but also the relevant work at the country level, working hand-in-hand with the Ministry of Health in every country, the most vulnerable countries in the world, to advance the health agenda. I'm sure that these people would be the first to recognize that this investment case, compelling though it is not an end in itself. It's not a document to be read and then put on the shelf. In fact, its true value comes when those who read it are convinced by the argument it contains and inspired by the prospect of saving 40 million lives over the next 4 years. So we are talking about 10 million lives each year. And for this to be successful, we need to take action now. I'm sure that few of you in this room need to be convinced about the value of WHO. You who are here today and the thousands of people that are also watching us online represent our greatest supporters and our closest collaborators. And that is why I'm asking you to take this message forward in your home countries. At your cabinets, prime ministers, presidents, ministers of finances, institutions, that we need to work about predictable, flexible funding for WTO is an investment with an excellent return for everyone, everywhere in this world. Thank you.
This is the Standard Podcast, the eye-opening experience for your ears.
สวัสดีครับผมบิ๊กบุญและคุณกำลังฟังคำนี้ดีพอดแคสต์สะสมศัพท์กันวลนิดภาษาอังกฤษแข็งแรง